Malou Salanguit is joining me from Manila in the Philippines, where she is an ophthalmologist and a practitioner in logosynthesis. She is currently completing a master's in clinical psychology and recently published the first peer-reviewed research about logosynthesis in the Transpersonal Research Journal. And the research article was titled The Efficacy of Logosynthesis in Reducing PSD Symptoms and Distress Among Adults with Adverse Childhood Experiences. So congratulations, Malou, and thank you for joining me. I'm really looking forward to this conversation.
Thank you, Cathy.
So to start, can you describe how you were introduced to logosynthesis and what made you curious to learn about this model?
Well, I got interested with logosynthesis while working on an essay entitled Who Am I? So I have always believed that I am more than just a physical body and mind, and I'm certain that the other share the same sentiments. During my time in grade school, I experienced hospitalization that led to a near-death encounter. In that moment, I witnessed myself lying in the hospital bed, surrounded by nurses and doctors, and when they injected something to me, I sort of went back to my body and woke up. Another significant incident occurred when my grandmother died, and I was about 12 years old, and I woke up one morning because of somebody gently touching my chest, and I realized it was her. And when I was about to call her name, she placed her finger on her lips and slowly faded away. So, logosynthesis believes that we are more than body and mind. We have essence, a higher self. So that made me interested with logosynthesis. In addition, logosynthesis embraces the concept that everything is energy. Although I am not a physicist and may not be fully aware of its implications, I have personally encountered this happened when I was fervently praying in church within the hospital, within the shopping center every evening after visiting my daughter, who was receiving care in the neonatal unit due to being born prematurely. I wasn't able to go back to that chapel after she was discharged, and about after 1 to 2 years, I went to the vicinity of in the area, and I felt this familiar sense of energy that made me um, remember how it was when I was praying intensely during that time. So, yes. Another thing is that according to the principles of logosynthesis, when we encounter difficult and challenging situations, a portion of our energy becomes disconnected from our essence. This disconnection forms introjects, which consists of internal energetic construct derived from our own life energy, as well as external energies that come from our environment. Along with our reactions during the event, these introjects create a frozen world in 3 dimensions within us or in our biofield, which I would like to think that it's our personal space. So dissociated parts and interjects hinder our ability to fully understand and live through our core self. So the frozen worlds that are formed distance us further from our core self. Logosynthesis posits that each individual possesses an inherent and unique nature, and the more we stray away from it, the less effective we become. I believe we all notice that we possess our own inherent and distinct nature. We have our own individual capabilities, talents, and ways of perceiving things. There is an intrinsic quality within us that remains unaffected by the actions or thoughts of others. I have 4 daughters, and all of them showed apparent differences from the time they were born. Our reactions to specific things vary also because we are who we are. We possess a core identity that is exclusively ours. In the field of psychology, understanding our true self can be equated to having clarity of our self-concept. According to a study conducted by Bartanian, individuals who possess a strong sense of self-concept clarity are less influenced by outside forces and therefore engage in social comparison to a lesser degree. A teenager who has a healthy self-concept clarity is more likely to spontaneity, creativity, originality, and has high self-esteem. They have self-confidence and are motivated to achieve academic success and accept others without negative emotions. Negative self-concept in adolescence has been associated with various maladaptive behaviors and emotional problems. Problems and difficulties can lower self-concept, but low self-concept can also cause problems. When people know themselves, they can maximize outcomes because they know what they can do and what they cannot do. Self-concept continuously protect us from losing our self-esteem. For this loss produces anxiety. Um, Self-esteem is an affective or yourself. Logosynthesis takes us closer to our true selves, thereby increasing our self-concept by dissolving interjects and dissociated parts and freeing the flow of energy. Um, Another principle of logosynthesis states that the power of words can dissolve rigid structures and release trapped energy, allowing our authentic selves or core selves to reclaim it. While it may be challenging to fully explain, it is important to recognize the profound impact of words. This aspect is a good area of research and investigation. What makes logosynthesis, however, unique, however, is and easy and well suited for online application is its use of words. Personally, I decided to try logosynthesis and addressing my own anxiety because of a complex surgery. Initially, I didn't see immediate result, but after two or three more tries, I had a relief of symptoms. I was no longer consumed with the thought of it, and I had improved. I have neutralized my limiting belief. Also, during my work with clients, I have also explored the use of logosynthesis in conjunction with EMDR. I follow the usual protocol of EMDR, which is the image, the triggering event, uh, negative negative thoughts or emotions, body scan, validity of positive cognition, and also the other one, and subjective unit of distress. However, instead of the tapping or bilateral stimulation, I used the logosynthesis sentences, and the effect was good. It gave relief to the patient, to the client. So I said to myself that if we can use words instead of bilateral stimulation, this process um, can make it a lot easier. So that's why I started to really got interested with logosynthesis.
Yeah, it sounds like it has a very deep connection for you personally and also academically. So, in your personal life and in your work life. And it sounds from all that it's certainly intrigued you to explore more and to see how you can enhance healing for yourself and for others. So I certainly appreciate that perspective.
Sorry.
It's easy, but it's very deep, isn't it? Like it's easy.
Yes. The process itself seems easy, but you have to go through that. To You still have to know the points where you can really um, see how it can bring out the best for your clients or patients.
Yeah.
Right.
So you have been studying logosynthesis, and then you decided you're going to do research and publish it. So can you tell us a little bit about what inspired you to actually publish research on the topic that you chose?
The theme of my article revolves around the use of logosynthesis as a potential tool for mitigating the symptoms of PTSD and distress in adults who have experienced adverse childhood experiences. Given the prevalence of trauma-related issues in our society, this research aims to shed light on an alternative approach that could potentially offer relief and improve well-being for those affected. Many studies highlight that adverse childhood experiences can lead to extreme emotional experiences, thereby increasing vulnerability to anxiety. This is primarily due to its regulate voluntary and involuntary attention towards potential threats. It is imperative to note that psychological distress caused by the maltreatment and neglect during childhood may continue until adulthood. Such as distress can have significant impact on physical and mental learning capabilities, employment readiness, and parenting abilities as well. Therefore, it is crucial to address the adverse effects of ACEs and psychological distress for a fulfilling life in adulthood. For Ehlers and Clark study, they said they emphasized on some aspects that are perceived to play a role in the creation and endurance of PTSD. The recollection of the traumatic incident are not profoundly explored or integrity activation or the experiencing signs when similar triggers are present. This deficiency in elaboration or of the trauma recollection is caused by one, deficient intellectual handling of the occurrence while it is happening, and two, post-event cognitive avoidance, which stops a transformation in memory. They theorize that post-traumatic stress disorder can be maintained when people mentally process the trauma in a manner that results in a feeling of present danger. This feeling arises from two contributing factors, or three: pessimistic or negative assessments of the trauma and its consequences, disruption of the autobiographical memory, which is characterized by inadequate detail and context, strong linkages between memories, and powerful perceptual activation. Negative appraisals and trauma memory are kept from changing because of the series of ineffective behavioral and cognitive coping strategies, which I think is the second and third degree dissociation in logosynthesis. While the event was happening, our reaction was not logical, and afterwards, when we think about it, we stop because it triggers the negative feeling that we had during that time. So the processing of the event does not push through. Recent studies have shown that trauma-focused therapies such as cognitive processing therapy, prolonged exposure therapy, and eye movement desensitization and reprocessing are highly effective in treating PTSD. In fact, these therapies are currently the most successful treatment options available for trauma-related disorders. However, patients may encounter challenges in accessing this type of therapy due to shortage of trained therapists or other reasons. In such cases, alternative psychotherapies like logosynthesis could be considered as an effective option. To address the deficiency in conventional treatments, despite the undeniable effectiveness of trauma-focused therapy method, it's always worth exploring alternative options when necessary. So the three most recommended psychological treatments for PTSD target the negative or distorted cognition of the client to bring about change. But in logosynthesis, the memory of the event and its perceptual cues, including the emotional and cognitive associations with the event, are being probed and eventually processed with the power of words. Logosynthesis does not process the belief itself, but the perception, which changes the cognition. So in logosynthesis, adverse childhood experiences create a frozen world of or energy construct in three dimensions, but in oneself and one's biofield. And it is just not an abstract cognitive concept. So logosynthesis is often described as simple and effective approach, although it has not been extensively studied through experiments. Conducting evidence-based research is crucial to increasing its acceptance within the therapeutic community. So that's why I decided to do a research on logosynthesis.
Well, and that's a huge step, right? So once one peer review journal article is available, it offers an outline of how other people can approach the research and what types of research questions they may ask and what issues that they wish to explore. So thank you for that. For those who haven't yet read your research, I will put a link to the research article in the comments below the video and the podcast. But can you tell us about your research question of what you found?
So this study aims to evaluate the efficacy of logosynthesis among adults with a history of adverse childhood experiences by showing a decrease in PTSD symptoms as measured by the IES-R questionnaire, and decreased distress as measured by the subjective unit of distress, and belief in negative cognition as measured by the negative but validity of negative cognition scale after the intervention. So the study used a multiple baseline design, and it was used to because of the undesirability to return to baseline and to implement direct replication.
Okay. So I understand that you followed each participant for several weeks before you offered the intervention using logosynthesis. And this following initially was to measure their level of distress and to see if it was sustained. And then you offered the intervention using 1 to 2 sessions with logosynthesis. And then you followed them again afterwards for several weeks to see if the distress returned. So is that,
Yes.
what did you find with that?
Okay. So yes, we have three dependent variables. They were measured 3 to 6 times weekly before the start of the logosynthesis intervention, and then again for second, third, fourth, and the 8th month after the intervention. Is it possible to share slides at this
Yes.
time?
Yeah.
I'll start with this first. So you were asked cases for this experiment. So we have the A phase with the dependent variables for them to answer for 3 to 5 weeks. Depends on randomly who will start the intervention. This is to give us some control for the extraneous variables and for its validity. So the first week, it was first to third week, all of them had taken it until the fourth week. But then after the fourth week, the first one started the intervention, and then the fifth week, another one started, and I think two started, and then the sixth week, another one started. So it was random. They were randomly picked during this time. And then after the intervention, we started the post intervention measures. So we gave the same dependent variables, and they had to answer it on the first, second, third, fourth, and 8th week post intervention. So for our participants, this is what we got during the screening. We initially had I initially had 17 potential participants, but there were some who were not available for this long type of research, and some were underage, some lacked this like I needed 2 ACEs for that for this experiment, so some only had one, or the SUDS is, did not come up to the criteria. So this were the 4 participants, and these are the number of scores that they have. They have 5. Lito had 5. TM had 3. Sheila had 2. And June had 6 adverse childhood experiences. But I got the worst issue, which is for Lito, that was neglect and abandonment when mother left for abroad. And then TM had sexual abuse. Sheila had her father died early, and June had physical and verbal abuse. So if we are going to look at the initial IES-R, which is the PTSD symptoms, the normal, or not really normal, but the potential for it to have PTSD is 24 and above. So these are pretty high from the baseline, from the 24 cut off. So the initial score of Lito was 70. TM had 42, Sheila had 50, and June had 54. And the SUDS, the screening, the criteria for this is more than 5. So these are the SUDS that they have. They have 8, 7, 7, 6, and the validity of negative cognition had 8, 7, 10, and 10. So this is the graph for the IES-R, and this one for the SUDS, and this one for the validity of negative cognition. Anyways, I summarized this. I put this together in one page so that we can we can compare it. So for this, we see the significance of the result depending on the changes in the level, lines, the overlapping of data points, the latency of change also. So when you say level line, it's the mean. You look at the last score for the baseline and the initial score for the post intervention. So from here, this is from a 40. We had like probably this was a 4 or maybe a 0 at this point. So the level change was really high for the IES-R. And the IES-R change was immediate as well, because after 1 week, we gave this questionnaire so that they can observe the symptoms for the last 7 days after the intervention. So you can see the scores are pretty stable after the intervention and before the intervention. So there were no overlapping of data points. So when you say overlapping of data points, one of the data points in the post-baseline, post-intervention phase should equal the data point here in the baseline. So there wasn't in any of these graphs, can you see overlapping? And in all of this baseline and post-intervention scores, you can see the high level change, probably except for Sheila. But even with Sheila, even if the change was not that as great as the other ones, it has already lowered to below 24, which is our cutoff for IES-R. But then another treatment was done here, and after a week, it went down to 0. So I think I had 2 intervention for Sheila.
Yeah, and sometimes it takes a while to, the especially if it's a very traumatic event, it can take several sessions of logosynthesis to kind of identify the key underlying memory that is triggering the distress, right? So it's not always that you can get to it, especially in complex trauma, that you can get to it with the first round. But those, that looks quite dramatic to me if I look at those charts, those graphs.
And you can also see the effect lasted until 2 months post intervention. So after Sheila, I got to talk to her after a year. I think she contacted me for something. And I asked her how she is, and she mentioned to me that, her problem was being dependent in a relationship. That was the behavior that she got because of her previous trauma. And after the she hadn't had any relationship after the intervention. She said that she wanted to focus on herself first, with her studies, and then after her work, and then and she told me that her preferences also increased. Like, what do you call it? High. She doesn't think so low of herself anymore. That
Wow, that's great work, because to me, the fact that data shows that the effect was immediate after the session and that the results were sustained, I think that is very indicative of what we tend to experience, right? Once that mental imagery in the form of a memory or belief or a fantasy about what could happen, once that is shifted and the energy in that is shifted and it no longer triggers distress, it doesn't come back. And so, those numbers reflect what we tend to experience when we're working on ourselves and with people, right? Great.
So we will look at the SUDS and the VoC all went down post-intervention. The VoC and the SUDS were same day post-intervention, the first data point. So they all went down. And surprisingly, like I just want to mention TM. TM had a SUDS of 4 post-intervention, but they did not do um any further treatment with her, but it went further down.
Okay.
So, but her cognition went down initially from during the post intervention. So I don't know if it has something to do because the cognition already went down, so it followed. The distress also went down eventually.
Yeah. And so we can say that's for participants, but that gives us an indication for further research, I think, down the road as well. So that is, it's helpful to set a baseline as to what might be possible. Okay, we can probably stop screen sharing if you want.
Sometimes it's funny when I try this on other people, like friends, or they seem to forget what their problem was after using the logosynthesis.
That's the beauty of it, isn't it? Yeah, I didn't have an issue.
Yes, it forget that they owe you something, that I processed their problem. No, that's just kidding.
No, I had it with someone who had a pain in her back, and it was related to grief. And at the end of the session, it's like, well, that pain is gone. And then later on, I was saying, well, did the pain come back? And she's like, no, that physio I had was wonderful. And I'm like, you had been doing physio for, weeks, and the pain was there. And then we did one session with logosynthesis, and it was gone and didn't come back. So, yeah, that is one of the challenges with it, because we're used to other treatment modalities, and sometimes we say, oh, that must have been what happened, because we can't really appreciate how something that we've been dealing with for a long time could just dissolve, I think. Yeah. So my next question is that there are a lot, like I just mentioned, there are a lot of treatment modalities that are available, and this is only one. So it's not to say that it's going to heal everything that, but it does integrate well with other treatment modalities. Can you describe what is different when working with logosynthesis from other methods? Like, how is this different from your perspective?
Well, working with logosynthesis makes it easy because you just ask for, would I say it equates to EMDR as well? EMDR and logosynthesis has a lot of similarities in terms of asking the ones you asked previously before the intervention itself. You ask for the image, the body scan, the VoC, SUDS, the OC, but the process of processing it is different. Like you have the bilateral simulation and the words. So of course, words are easier, but I would say that it almost has the same effect. That's why, for me, EMDR has a lot of evidence-based studies. That's why I want also logosynthesis to have one, because it will be easier to use for a lot of other people. Cognitive behavioral or therapy is not, sometimes it's longer, I think, because you have to really go deeper in analyzing the person. So, and then for the prolonged exposure, you have to they say that there were a lot of dropouts also for this kind of therapy. So maybe it's better if you find an alternative therapy that can be easier and that can work better for the
For the
client. Yeah, for the patients, yes.
Yeah, and one of the things with logosynthesis, so with the mental imagery and the logosynthesis basic procedure, we often start with what are the emotions, what are the thoughts, what are the physical sensations. So it's all those reactions that we're experiencing, um, reactions or symptoms, right? So it's getting in touch with the symptoms. And once you allow yourself to go there, because quite often if we feel those symptoms coming on, we might try to brush it away or not get in touch with it because we don't want to feel the distress. But in this, safe contained space, working with a therapist or a coach, and you are comfortable and confident to allow that distress to connect with that distress, that's when the distressing mental imagery, that distressing memory, that belief actually appears. So it may not be in our conscious awareness. So the beauty of logosynthesis is that it's a very specific process to guide you to get in touch with those memories that may be suppressed. And especially in trauma, we suppress them for a reason, but yet they're still operating outside of our awareness. And so being able to connect with that distressing memory and process it using the sentences is extremely beneficial. And in my thinking, that seems to be a little unique to other methods as well, isn't it?
Yeah. Actually, there are methods that also cognitive is cognitive, but like EMDR, as I've said, it also asks that the perceptual cues, which is actually very important because at some point when we remember that event, we only remembered what we feel, what we see, what we hear, or what it makes us, um, you know, fight, our fight flight response gave to us. Like that's what we remember, so we panic. And when you try to remember it again after some time, you try to avoid it. So it doesn't help when you try to remember. So it becomes a cycle. Instead of remembering it, you do something to make you forget it. Like, the second and third degree dissociation, wherein you do this so that you don't have to remember that. And, it's supposedly a positive thing. But then in the end, you become troubled by it when it's too much that it's already causing you problem. Like one of them, his problem is, I think, perfectionism, because every time he does something has to do with, multiple times before he can be at ease with his work. And that was because when he was a child, his father used to abuse him every time he made a mistake. So, when we processed this, he told me that he became more efficient and more accepting of what others think. He's not defensive if it's wrong, or he appreciates it. And also he said that it's more efficient in doing things. It's not because perfectionism at some point becomes a problem, right? Gives you a lot of anxiety.
Yeah. Well, and it impacts how you deal with other people, right? That they end up feeling that stress that you bring with the perfectionism. And yeah, those Kaylee's drivers, those 5 drivers of hurry up and work hard and please others and be strong and be perfect. Those, they serve us well, but especially with age, they become quite rigid and they can be quite debilitating. So being able to shift the energy in it, so there's nothing wrong with, doing your best until that energy in it just makes you so reactive that it's getting in the way of your work, isn't it? Yeah.
Yeah, one thing that's very good in logosynthesis is that it changed the perception, right? So because it changed the perception, it changed the cognition. So it's vice versa. Like, you know, and I think it's very effective because it is correct that when you're having the event, you're so confused, everything is so different when you try to process it in a logical way. So when you start, like, for example, TM, at that point, she was there was a point where she until now before she was so guilty because she was molested because she was blaming herself, and afterwards during the process she remembered, um at the side corner of her eyes she remembered the wife of the perpetrator, and that she saw them but she didn't do anything. So she realized that she didn't know anything. Why did she not do anything? She's the one, you know,
Yeah.
also to blame because
Yeah.
she's just a young child. She doesn't know that. And now, of course, at least her cognition of being to blame for the situation has gone to 1 or 0. So, but then of course the situation didn't change. It still happened. So there's this wish that it didn't happen, right? So when we processed that, she started also decreasing the SUDS. So
Yeah. And that's where the power of words come, right? So words have the power to shift energy. And I mean, that's where prayer comes in. That's,
yeah,
words are energetic in nature. And those memories are energetic in nature. So to me, it is quite logical that if you choose the right words to shift the energy, that cognition can actually shift, or that perception, I should say, can actually shift. And it's I find when you're working with someone, they have the image of an angry parent, or an angry stern teacher, and after they do the sentences, either the image dissolves, it's not there anymore, or the person is now smiling, or the person is further away. Um, and that, just that shift ends up changing those sensations and those emotions that have kept them stuck so long in those reactions.
yes, when we do logosynthesis, right, it changes every time you say first cycle of logosynthesis, this is what happened, and then afterwards another thing happened, another image appear until it processes the whole thing. It's not necessarily all the same. Like one is guilt, one is anger, and then also the other one is wish, right? And there's this one thing also, like what you said, it's the change in perception. Like when she was guilty because she felt that her dad had a stroke because of her, and that was because they were planning for her birthday, and it was a big party. So I think she thought he was stressed that he had a stroke. And so when during the party itself, she had this image of his dad, wherein she was so sad looking at him from afar because he was lying on a hospital bed at the corner of the party room. So when we did the after we did the sentences, he realized that he was proud that he did this because he loved her. So he shouldn't be guilty. You know, that it wasn't he shouldn't be blaming herself, but he should be grateful for what her parents did. No, it was because they loved her and that they were proud.
Wow.
So yeah,
What a nice example.
it's just beautiful.
Yeah. So, do you have a key message that you would like to leave with people about what logosynthesis can offer?
Okay, so logosynthesis give immediate and lasting result. However, treatments that have highest evidence should be the first line of treatment for PTSD whenever possible, with consideration of patient preferences and values and clinicians' expertise. This is according to what Watkins. So I urge our co-practitioners to, let us do research on this, study on this, so that we can spread logosynthesis to a lot of other practitioners, to a lot of other therapists, so that they can be useful. They can be used by everyone. I just think that it's really easy, and it should be. It can be easily taught. It can easily be done. So it can help a lot of people.
Thank you. Yeah, that's a great message because there are so many people out there that have been looking for something to actually resolve those distressing memories that are associated with PTSD. And so when they come across logosynthesis, they are eager to explore it. And yet, I agree with you, it does need the research to make it evidence based and to prove that the results are immediate and lasting. So thank you for that.
Yeah. Yes. So, thank you so much, Cathy.